Okay.
Okay, I think there was a little bit of a relay, so I apologize, everyone. So we are now live on YouTube and on Facebook. As I mentioned before, I wanted to kind of do this conversation this evening about COVID-19 due to a recent death to a person that I knew. And in honor of his memory, I felt like it was appropriate. It was appropriate before, but it became even more important for me to do this. We do have two very wonderful guests that's going to be joining us and lending their knowledge to us to kind of help us crack down this COVID-19, the pandemic, the vaccination. And then at the end, the tail end, we'll open it up for a couple of questions and answers that I've received. So without further ado, before I allow her to introduce myself, I totally forgot I didn't introduce who I was. I'm Attorney Davis. I am a candidate to be your next Broward County Commissioner here of District 6. I'm also an attorney. I have a small boutique firm here located in Hollywood, Florida, where we specialize in criminal defense and Attorney McNeil, are you there?
Oh, I'm here now. I didn't hear anything at all for about 2 minutes. Can you hear me?
Yes, we can.
Can you?
I've
I
already
think
introduced myself. Are you in a space where you can introduce yourself and kick us off?
yes. Can you hear me?
Yes, we can.
Hello. Okay. So my name is Attorney Beverly McNeil. I'm a Social Security disability attorney, and what I do, I have just like as Dameka said, I have a small firm. It's a solo firm, but it's a firm in which I strongly believe in because I enjoy what I do, and that is helping people who need to receive disability benefits or they want to appeal the denial of receiving their disability benefits. And it's Social Security disability as opposed to long-term or short-term disability. And I guess I will go on and start with the topic. So one of the questions is that I get, especially in this day of COVID-19, is can you apply for disability if you have COVID? And the thing with those Social Security disability, and I apologize if it's loud, I'm actually in a space right now, therefore, but I'm here and I'm talking to you guys. So can you apply for disability if you have COVID-19? To apply for Social Security disability, it's not a temporary situation. Social Security disability does not award benefits for you if you have a temporary disability. If you are out of work for only 2-3 months or it has to be at least 12 months or more, or it's expected to be 12 months or more that you are not able to work. As we know, COVID-19 usually lasts a few months, few weeks, depending on the person and depending on the immune system, correct? And depending on if they have pre-existing diseases or underlying diseases or not. However, as we have seen, during this pandemic, that a lot of people who have COVID-19, unfortunately, has died from it. And, or they suffer long-term effects, and they call them the COVID long haulers because of the COVID-19. Even though, let's say they heal from COVID, don't have COVID anymore, now they have lung problems, now they have breathing problems, now they have pneumonia, now they have issues that is basically causing them not to be able to function in everyday life. Now, those individuals, can they apply for Social Security disability? Yes, if the symptoms from having COVID has caused them not to be able to work, like I said, 12 months or more. And again, those individuals that are considered long haulers and dealing with the symptoms still, and yeah, those individuals should definitely look to see to apply for Social Security disability. So if you're an individual that you unfortunately had COVID, and even though you may have healed from COVID, but you're still dealing with all these symptoms, and it's causing you not to be able to work your job, and you have breathing issues, and you just have all these other type of, you still don't have your sense of smell. You know, it caused other things. You can't sit as long, stand as long, walk. Just basically, it's limiting your job, right? And like I said, 12 months or more, then definitely you should look into applying for Social Security disability if COVID-19 has affected you in that way. But just because you have been diagnosed with COVID, and let's say you because of that, you're probably out of work for a few days or maybe a few months, is not enough for that just to apply for Social Security disability. And that is it. I'm not sure, is Attorney Dameka Davis, are you still there?
Yes, I am.
Okay, I wasn't sure.
No problem.
So,
well, thank you
any
so much.
questions?
So it sounds like based upon, what the Social Security Administration, what they're doing at this time is they don't really have a bright line rule.
No,
What it sounds like.
because it's new, as we know, it's new, and they're not even sure yet, right? But as time goes on, I'm sure Social Security will make some changes. Also, because in the world of remote, one of the things about Social Security disability, they'll try to say, okay, here are these other jobs that you could do, right? And that list of jobs, which is in this book that we call the Department of Titles, the DOT, it hasn't been updated in a while, right? In the world of COVID, with all these remote jobs now, that needs to be updated. So there's a lot of things with Social Security in regards to COVID that really needs to be upgraded. But right now, it's not. It's not. There's really no yes. No, it's a funny area right now. So.
And is that your whole reason? I guess I know you can't give us a definite reason because, of course, you're an attorney and you can't guarantee any particular results. But based upon your legal opinion, do you find that, maybe some of the people with these long-term
the long haul
symptoms,
haulers,
haulers, they may have a better chance, although you can't guarantee it, correct?
Yes, a better chance, right? A better chance, because the long haulers are dealing with this in a long-term situation, right? So it's something that will most likely be more so the 12 months as opposed to you just having COVID for, how the average individual has it, which is a few weeks, a month or so. So, yeah.
And then if there are people or viewers that are watching that maybe want to get a hold of you or want to contact you, how would they do so?
Well, the easiest thing is to go to my website. So I will put my head down for a minute so you can see how to spell my last name. So just go to www or just themcneilfirm.com. THE McNeil, McNeil, 2 L's, remember that, firm, FIRM.com. themcneilfirm.com. All my information is on there, and you could contact me if you have any questions or if you want a free case evaluation because you feel like you need to apply for Social Security disability. That's the best way to contact me. And I think we are frozen.
And you'll still be available maybe if we have any questions related to that, right?
Oh, I didn't get my phone. My phone was breaking up. Say that last part again. Okay.
I was just wondering if you'll try to stay on as long as you can, considering the fact that you're in the airport and you're traveling.
I will try, yes.
Okay.
I will try, but I can't make any promises. So.
And I'll also put her, for anyone that's watching, I'll put her office information in the comments section. I refer all my Social Security and disability cases to Attorney McNeil, and I highly recommend her. And also, I didn't say this in the beginning, but I wanted to just let everybody know that the information that Attorney McNeil has lended to us is just that. It's just information. And it doesn't create an attorney-client relationship unless you contact her and you actually conduct a consultation and you extend representation to them. So I just wanted to make that clear.
Thank you. So yeah, so I will try to stick around as much as I can. So I hope this information helped in some way. And again, if you want to contact me, the easiest way is just go to the mcneilfirm.com and my phone number, contact, and everything is on there. Okay.
Thank you so much for being a servant
You're
and being here
welcome.
in light of the inconvenience. We really do appreciate it.
Thank you. Thank you for having me. I appreciate it.
Safe travels, my friends.
Thank you.
Okay, and now we're going to hear, I had a poll for anyone. I'm just not sure if you guys will be able to view it. But if we, Ms. Jones, if you don't mind, I'm going to we'll jump right into your discussion.
I'm sorry, Dameka, you cut out. What did you say?
I just said I have a poll. I created a couple questions for people to answer. And so I'm just going to publish it and we'll give folks a couple minutes to answer it. If there are people that are slow to coming in, they can come in too. So we'll take a pause for a couple seconds here and I'll do the poll.
Okay.
And then we'll hop right into your presentation. Okay, so I just wanted to kind of publish some of the results that are here and give folks a couple minutes to kind of join in. I know we're here from all different time zones. Some people are doing this via the live stream, and some people may be kind of trickling in into the room. So without further ado, I wanted to introduce you guys to someone that I trust and that I care deeply about. And I know she has the same heart for our community as I do. I wanted her to introduce herself because she is more than qualified to be here and to give us direction on this topic. So at this time, Nurse Jones, I'm going to turn it over to you.
Hi, everyone. I'm Kathy Jones. I'm a visual nurse consultant with C. Jones and Associates. I'm going to share my screen. I did a PowerPoint on COVID this year, and I'm going to quickly go through some of it with you. And if you have any questions at the end, you can just let me know. Can you see my screen?
Yes, we can.
Okay. So about me, I've been a nurse for 20 years. I've worked in various units throughout my career, and now I'm a legal nurse consultant. Okay. Consulting on many different types of cases. So we are in a pandemic, which the last pandemic was the Spanish flu in 1918 to 1920, which infected 500 million people. The current pandemic is SARS. The medical term is SARS-CoV-2, which we all know is COVID-19, which started at the beginning of, around the end of 2019, beginning of 2020. The coronavirus is a group of viruses that cause diseases in mammals and birds. In humans, it causes respiratory infections, usually mild. There are several different variants. The variant that we're worried about now is the Delta, which spreads very easily. Oh, I'm sorry, went the wrong way. So who's at risk? Everyone is at risk. But the most people that are at risk are people 60 or above, people with comorbidities, people that are in nursing homes, long-term care facilities, prisons, and or jails. So people with comorbidities, I'm talking about people with cancer, kidney disease, obesity is one of them. That's a very big one. Sickle cell transplant, pregnant women, all these people are at risk. So if you see here, hypertension is the big one, obesity, chronic lung disease, diabetes, and cardiovascular disease. So there's different types of testing for COVID-19. What you have is the NAT test, which is known as the PCR, the antigen test, and the antibody test. Symptoms of COVID-19 are fever, cough, shortness of breath, chills, muscle pain, headache, sore throat, loss of taste and smell, and that's the number one factor that differentiates between the flu, is the loss of taste and smell. If you have the flu, you're not necessarily going to have a loss of taste and smell. You will have, you could have fever, cough, chills, shortness of breath, but you won't have that loss of taste and smell. So there's different severities of COVID, which you have the asymptomatic, you have mild illness, moderate illness, severe illness, and critical illness. So critical illness is the people that are in the ICU on the ventilators. Asymptomatic are people or individuals that are walking around that have no symptoms. They test positive, but they have no symptoms at all. Mild is mild and moderate to moderate symptoms. Considerations in children. So it can be, the disease can be severe in children. It's called the multi-system inflammatory syndrome in children. there have been quite a few children that have died from COVID-19. It has not been, of course, reported in the media, but I know personally of a few people who lost children due to COVID-19 because of the MIS-C. So it is something that can happen to children, which a lot of people didn't think it could. I won't go into all this pharmacology stuff with you guys. So let's talk about the vaccines. We have the mRNA vaccine and the viral vector vaccine. The mRNA vaccine is the Pfizer and Moderna, which both consist of 2 shots. The Pfizer is 21 days apart, and the Moderna is 28 days apart. The efficacy is 95% on both those vaccines. The viral vector vaccine, let me go back. So the mRNA vaccine, which a lot of people don't know about mRNA unless you're in the medical field, all it is a messenger protein that's on the end of a cell. And when they inject this vaccine, your body reacts to it and it remembers it. So if you get infected with COVID, it remembers it and then it tries to eradicate it, or that's why you get less symptoms. The viral vector vaccine, which is Johnson & Johnson, is 1 shot. It is what's called an adenovirus, which is an inactivated virus that can't harm you. It's not COVID-19. It's another virus that's inactivated, that's basically dead. So that is what a viral vector vaccine is. Let me keep going. So of course, it's recommended that everyone get vaccinated. They just approved children from 5 to 11 to get vaccinated because there's a growing population of COVID cases in the schools now that schools are back in. So they have approved that. It is not mandatory that your child get vaccinated, but it is advised. There are some conditions. There's one myth going around that is not true, which is saying that if you give it to your children, it will make them infertile. And there is no basis for that at all. A lot of people are worried about that, but it hasn't proven to be true. So let's close this out. Sorry, I lost my, oh, here it is. Can you hear me?
Yes.
Okay. So now just talk to you. So like I said, the vaccine has now been approved for children 5 to 11. The Biden administration has secured 28 million doses for children to be vaccinated between 5 and 11. There have been reported by the CDC as of, I think it was the day before yesterday, there have been 745 deaths of children due to COVID-19. And since now that it is what we call flu season, you can't necessarily tell the difference between flu and or COVID unless you go, one, get tested, get you or your child tested. And right now, we know if you take your child, if you suspect that your child has COVID and or the flu, you can take your child go to the doctor and get tested, but you want to make sure that you ask the doctor, can you test them for COVID, depending on your child's age, RSV, and the flu, because they can test for all 3 of those and tell you which one they have, because your child may not have loss of taste and smell. Your child may be asymptomatic, you don't know. So it's good to ask for that. The Delta variant is very contagious. That is why it doesn't get you sicker. It just it's more contagious. So instead of infecting 1 in 3, it's infecting 3 in 3. So everybody who's getting the Delta variant can spread it very, very easily. It's very easily spread, unfortunately. And then we have the people, of course, like Bev had talked about earlier, there are the long haulers. And some of the long haul symptoms are brain fog, cognitive impairment, fatigue, anxiety, depression, PTSD, cough, chest pain, requiring shortness of breath, requiring the person to be on continued oxygen while at home once they've been released from the hospital, fast and pounding heartbeats, loss of taste and smell, dizziness when you stand, joint pain. Those are some of the things that long haulers can experience. And depending on what symptoms you have and what's going on, I personally had a friend who was very sick. She ended up in the hospital and currently is at home. She threw a blood clot and she's currently at home on oxygen. And it's been a couple months. It's been a couple months and she's still at home on oxygen. So depending on your specific, health is depending on, what can happen and how long these symptoms can affect you and if they affect you for months, or we really don't know how long it's going to affect people because we just started this. We're only 2 years in. So we don't know in 5 years, are people still going to be having breathing problems? Are their lungs going to be permanently damaged? Are they going to be able to recuperate from the damage they got from getting COVID? That information we don't know yet. And that we'll see as time goes on. Do you guys have any questions?
Yes, I am filled with questions. Thank you so much for giving us that information. And we really do appreciate it. And thank you for just being able to kind of boil it down to something that everyday people would be able to understand. I have plenty of questions for you. And honestly, these were questions that were submitted to me in advance. These were questions that I had. These were questions that my community had. So just wanted to ask you a couple follow-up questions. One of the main things, well, I think you had mentioned it before, is that the CDC gave us guidance, excuse me, that they were given the green light for children between the ages of 5.
You cut out, Dameka.
Get vaccinated.
Dameka, you cut out. So say you cut out for like the last 30 seconds.
Okay, no problem. Let me know if you can hear me.
Now I can hear you.
Okay. One second. I'm hearing an echo. Okay. Do you hear an echo or is it just me?
I think it's just you.
Okay, perfect. Okay. So I kind of wanted to cue this up, and I think you said I cut off, but if you didn't hear me the first time, I just wanted to thank you again. You made yourself available at such a short notice, and I appreciate that. I appreciate you for doing that, and also boiling down this really difficult, hard content for us in a very simple, straightforward manner. I got some questions from my community. I had some myself. And these are just straight questions that people have, and obviously concerns that our community has. So the CDC, the first question that was submitted was, the CDC released some guidance with regard to children ages 5 to 11 to get vaccinated. And so based upon what you know about the vaccine and COVID, do you recommend that our children within this age group get vaccinated, or do you think we should wait?
So my personal opinion is that I never tell anyone to get vaccinated or not get that is a personal decision for you and your family. Because just like anything we put in our bodies, there can be an adverse reaction. And that's a decision that you have to make. There have been clinical trials that have been done, and the CDC says it's safe for children, but we have to remember that just because something is deemed safe doesn't mean it's deemed safe 100% of the time for every single person in the world. And I think a lot of people think that, and that's not necessarily true. So I just say, make the best decision you can with getting vaccinated and getting your children vaccinated.
And with that, my follow-up question would be, are there anything or types of diseases or anything, or pre-existing, I won't say diseases, I'll say pre-existing medical conditions that we should take into consideration before we make a decision if we want to get vaccinated or not?
Yes, if you have any pre-existing condition, before you get vaccinated, you need to go talk to your primary care doctor. Your primary care doctor will guide you. And is this something that you should do, or is this something that you need to opt out of? Of course, if there is something in the vaccine that you're definitely allergic to, of course you wouldn't get the vaccine, right? No, there are people that are going to have medical exemptions to getting the vaccine. But compared to everyone else, those small number of people is not going to, it's not going to make a difference for those small number of people not to get vaccinated when everybody else that is eligible to get vaccinated gets vaccinated. So those small number of people that have those pre-existing conditions that cannot get vaccinated is not going to affect the world like people not getting vaccinated. If that makes sense.
That makes perfect sense. Okay. My next question that was submitted was, can you tell us about some of the side effects of taking the vaccination that are just side effects? And when should someone be worried? Like, okay, I need to go to the hospital at this point after being vaccinated.
Okay, so when the normal side effects, like I'll say for me, example, I'm vaccinated and my arm was sore, that maybe for that day, the next day, there could be redness, there could be swelling, there could be itching at the injection site. Anytime there's going to be what we call an adverse reaction, or a patient, or it's going to go into anaphylaxis and there's an emergency, it's going to happen within minutes. So that's why when you go get vaccinated, they make you sit there for 15 minutes, or they make you sit there for a few minutes prior to leaving. Because if you're going to have a life or death situation due to the vaccine, it's going to happen right then and there. It's not going to happen 2 weeks later. Because if something is giving your body an adverse reaction, your body's just not going to take it. It's not going to wait 2 weeks to react. It's going to react right then and there. That makes sense?
Oh, that makes perfect sense. I didn't even know that. So thank you for that. I was trying to figure out why they would make us wait for 50 minutes. You know what I mean? I'm like, what are they making us wait for? But that's why. Thank you. Okay, I got some real juicy questions. So what about the Johnson & Johnson vaccine? We got a lot of really negative information about the J&J vaccine. And so my community wants to know, should I be still taking this vaccine? Or if I got Johnson & Johnson, can I take another one like Pfizer or Moderna, if that makes sense?
So the CDC is saying that, of course, first let me address the concern with the Johnson & Johnson. Of course, there was concern. I would have been concerned too, because the Johnson & Johnson vaccine came out, and then suddenly it was pulled from the market because people were having adverse reactions. So yes, I would be concerned. But now the CDC says that if you need to get whatever vaccine is available to you. All vaccines are not available in every community. Most communities have, one or the other. not all of them. So the CDC says get what what you can, what's available in your community. As far as can you mix them? From what I've seen, they said that you can get a booster from any of the other vaccines, but a lot of people, of course, don't want to do that, right? They think that's like mixing oil and water, right? Like, oh no, I got Pfizer, so I have to get Pfizer booster. Because my dad, he actually just got his booster today. He got Moderna, and I had signed him up to go to Walgreens to get the booster, but when he got there, they told him, oh no, we don't have Moderna, we have Pfizer. So my dad's 70 years old. He went, hey, no, you're not shooting me. That's completely different. So I had to make him another appointment somewhere else where they had Moderna. But it is said that you can get a booster of another vaccine if you need to. But most likely, whatever you got into your community at that time is what they still have. So they probably still have the same vaccine.
Okay. Now, when are you suggesting, based upon the information that has been made available within the medical community, that people get the booster? Because now the big rush is for the vaccinated people is, when can I get my booster?
So let's see, you can get the booster. Let me see. It's 7 months. 7 months from the last injection, from the date of the last vaccine injection. That's when you're eligible for a booster.
Okay. Now, I wanted to also ask you, what about if you tested positive for COVID?
Mm-hmm.
Again, based upon, information that's available within your community, if I tested positive for COVID, can I rush and go grab, and excuse me, let me take a step back. So let's say, for instance, we have a person that was vaccinated.
Mm-hmm.
And they wound up catching COVID.
Mm-hmm.
Is the current recommendation to go run out and get another vaccine?
No.
Why not?
They need to wait and let their bodies recover. If you've been vaccinated and you get COVID, you shouldn't have, hopefully, because everybody is different, you shouldn't have as severe symptoms as someone who didn't get vaccinated. But they should let their bodies recover. Perfect example, I have an uncle. Same thing happened. Went and got, he had COVID, went and got vaccinated, like, I want to say 2 weeks later, and he got very sick because his body hadn't had a chance to process the COVID that he fight it off. And then he went and got a vaccine, and it just made him sicker. So I think that people should wait a little bit before they go between COVID, testing negative, let's make that clear, testing negative, and then going to get the COVID vaccine and or booster. They have
Do you mind repeating that one more time for the people in the back, please?
So someone who has COVID, they need to, first of all, they need to test negative. After they've had COVID, you have to have a negative test. After that negative test, you need to wait and then go get the vaccine and or booster. A lot of people assume that they had COVID, 14 days, it's gone. That's not true. You have to test negative. I know people personally who have tested positive for 3 to 4 months because the COVID was still active in their system. They weren't necessarily symptomatic, or had symptoms, but they still had active COVID in their system.
And as a registered nurse, what are some of the medical reasons why you should not jump up and go get another vaccine if you've tested positive for COVID and already were previously vaccinated?
So some of the medical reasons would be because you would just, when your body gets COVID, it's in a state of, I don't want to say shock, but it's in a state where it's not normal. It normally is not, right? So if you go and you have COVID and then you try to go get a vaccine, it just doesn't work right away. Like, I don't know how to explain it right.
No, I think that's how you explain it. If it doesn't work right away, it just doesn't.
It doesn't work right away. And if you notice, anytime you're vaccinated, they don't count you fully vaccinated until, I believe it's 14 days after your second dose. That's when you're considered fully vaccinated. Not as soon as you got the shot, not the first dose. You're only considered fully vaccinated 14 days after the second dose.
Okay. And I'm not sure if you had something else to add or if you had completed your thought.
I completed my thought, I'm sorry.
Okay, no worries. I just didn't want to interrupt you. Next question. I have a pre-existing medical condition. So for those that are tuning in, something like cancer, diabetes, sickle cell, etc. I think you kind of hinted on this a little bit earlier when you were saying that these people that's one of the reasons why you consult with a primary care physician. So I guess what I'm trying to say is, could you restate your answer with regard to people who have a pre-existing medical condition?
Okay, so people who have pre-existing medical conditions, they need to consult with their primary care provider. People are individuals. Every pre-existing condition is not the same, and some people cannot get the vaccine. But like I said, that's a very small number of people that can't get it. Of course, if you have a certain pre-existing condition, or if you have a allergy to something that's in it. So when I say pre-existing condition, let me explain. I'm not talking about people who have hypertension, diabetes. Those are what's called comorbidities. A pre-existing condition that you want to consult your doctor regarding is somebody who is severely immunocompressed, like cancer patients, people who have sickle cell, go into sickle cell crisis, people who have certain neurological disorders, Guillain-Barré, very rare disorders. But like I said, those people are very few and far between. If that makes sense to you.
That makes perfect sense. And is that why the recommendation from the CDC, from the Biden administration, from resoundingly the medical community is to try to get those of us who can get vaccinated to protect the immune, I forget the word that you said, I apologize for my ignorance.
Yeah.
But I think you understand what I'm trying to say. Is that the reason why they have given us, the powers that be, right, or the medical community have given us guidance to try to vaccinate as many of us that can get vaccinated?
Right. Yes, that's exactly why. They want the people who can get vaccinated to get vaccinated, so that that small few that can't, we can still keep those people safe. And everyone that I know personally who has gotten the vaccine, and I will say for me, myself personally, I didn't get it for me. I got it to help someone else. I got it to help my goddaughter who is immunocompromised. I was thinking about others. I wasn't thinking about just me when I got the vaccine. I was thinking about my dad. I was thinking about my godparents. I was thinking about those people who are older, immunocompromised, and COVID could literally just wipe them out.
And I also received another question. Is there one vaccine that's better than the other?
No, they've all have about the same efficacy. So there's not one that has a 50% efficacy and one that has 95%. They're all in the 90s. So no, there's not one that's better than the other. They're made differently, yes, between the mRNA vaccines and the viral vector, but there's not one that's better than the other.
And trying to play devil's advocate here, I was having this conversation with my family and those that are very close to me today. And, they expressed some very real concerns. And, I understand those concerns.
Mm-hmm.
One of their biggest concerns was, hey, guess what? This vaccine came out in record time. They haven't even came out with a cure for AIDS, cure for cancer, but they magically, boom, came out with this vaccine. I don't trust it, Nurse Jones. The research has not been completed. We don't know the long-term effects. What do you say to those people? Not so much a question, but more of a statement. Okay. What do you say to those people?
Got it. So what I say to those people is that this vaccine was not made in record time. A lot of people have that myth that this vaccine was made in 6 months. So when I did my PowerPoint, I showed you and I told you guys the medical name for COVID-19 was SARS-CoV-2. So I don't know if people remember years ago about SARS, when SARS came out. This is just, this is SARS-CoV-2. So there's just another, what's the word I'm looking for? There's another mutation in that. So they had been working on mRNA vaccines for at least 15 years. SARS-CoV-2 has been in, SARS has been worked on for at least 10. So it wasn't that they just came out with a new vaccine in 6 months or 1 month. They had already been working on these type of vaccines. All they had to do was change it a little bit to fit the science to get the vaccine. It wasn't that it just came out of thin air. It didn't.
So can you possibly speak to people's concern that's saying we don't know what the long-term effects are, Nurse Jones? So you expect for me to sit up here and take this vaccine and I don't know what the long-term effects of it will be?
So what I say to that is they're correct. Do we know what the long 10 or 15 years from now? No, we do not know. But what I tell people personally is, does the benefit outweigh the risk? So does the benefit of getting the vaccine outweigh the risk of you dying from COVID-19? Or are you willing to take that chance? And that's everybody's personal decision. That's a personal decision.
Another, line of thinking that we got to address as well that's kind of circulating in our community that I feel like may be fueling vaccine hesitancy is this, and you can just speak to it. Hospitals are getting paid to diagnose people with COVID. Is that true?
No, I have so many friends that work in the hospital. And they are so overwhelmed. And it literally brings me to tears. They're emotionally exhausted. They're physically exhausted from treating people that have COVID-19. The hospitals are not getting paid to say, oh, this many people has COVID-19. That is not the way the medical community works. That is not what we do. And if that were so, why did 5 million people die from COVID-19? There's been 5 million deaths worldwide from COVID-19. So No, I wouldn't say that hospitals are being paid to diagnose people with COVID-19. No.
Another question that I got is, with the recent passing of Colin Powell, I got a whole bunch of questions about, Ms. Davis, Mr. Powell had gotten the vaccine and he still died. So can you speak to the fact that what the vaccine does? And I'm not articulating myself very well, but I guess what I'm trying to say is there are a lot of people that have really strong opinions that say it don't matter. I'm almost damned if I do, damned if I don't get the vaccine. If I catch COVID, I still face a potential of dying. Why would I still get the vaccine when Colin Powell just recently died and he was vaccinated?
So I had this conversation earlier with a friend of mine. He brought this same exact thing. Well, Colin Powell was vaccinated, he died. So we don't know all of Colin Powell's past medical history. We're not saying that everybody who gets vaccinated will not die. We're saying that the vaccine most of the time prevents death. But we don't know Colin Powell's past history. You don't know what Colin Powell did in his personal life, if he took vitamins, if he took drugs. You don't know any of that. But of course, they're going to run the narrative that he was vaccinated and he died of COVID-19. That's just the narrative they're going to run, regardless of if it's true or not. And I think the only people that know if that is true or not are the people that gave him medical care. And those people know the full story.
Okay. Another question that I had, or more or less, I don't know if this is a question or a statement, but something most important that I think we got to target to as a member of our community or of a marginalized community is if you could please address historically some of the distrust, I guess, so to speak, between the African American community and the medical community, because based upon history or whatever, I don't know the exact medical history, so I'll let you kind of do that. That's not my lane, but I think you know what I'm trying to say. There are plenty of people that are going to be watching this and will say, nope, see, Attorney Davis, what they did in the Tuskegee experiment, they were purposely injecting people of color with a vaccine that had whatever it had in it. And they was giving these men and these people diseases that was blood in their blood, And so that is people feel like this is another example, right? Of, a forced vaccines. Some people see it as forced, right?
Yes, they do.
And so can you address that or speak to that? And again, not a question, but more or less just.
I get where you're going.
Yeah.
So I get from the Black community how the Tuskegee experiment sits with the Black community. And yes, those African American people were injected with a vaccine that got them sick. But in today's age, they're not targeting this towards one race. This is worldwide. This is not only in America, this is worldwide. You see people dying. So in this vaccine is worldwide. So they're not targeting one race or one ethnic group here. And I feel that that's evident that I feel that you should see that they're not targeting just Black people or just brown people or anything like that. That's why there have been a lot of people in the Black community. Bishop T.D. Jakes, he had a panel of doctors on that broke everything down about the vaccine, about COVID. Tyler Perry also had a panel of scientists that came on and broke it down. The scientists that one of the scientists that were involved in making the vaccine was Black. So it was an African American female. So I don't see how people think that it's targeted, but because I don't see it targeted. It's worldwide. Everybody is asked or mandated, kind of, to get the vaccine in certain situations. And this is worldwide. In America, I feel we have access to the vaccine where other countries don't, and they wish they could, and they wish they could take the vaccine, and they've seen their family die or their loved ones die, and they don't even have access to a vaccine. But in America, we have access to the vaccine, and people don't want to take it, which is their right. You have a right to put anything, you either put something in your body or not put something in your body. That is your individual right. But I don't think this is the same as the Tuskegee experiment. I see it differently myself. Did that answer your question?
That absolutely did. I'm just trying to go over my little questions that were given to me before. And that looks like that completes it. I do have a family member. I'll share a personal story here with everybody. So I told you earlier this week that someone that I knew that my children were very close to passed away. He was elderly, and you mentioned it, you hit it right on the head with regard to, some people in different countries, they wish they had access to this vaccine. He was actually in Haiti, where to my knowledge, not one single vaccine has been administered on this island. And he caught it and died just purely off of accessibility, right? And so that is really why I came begging to Nurse Jones and to Attorney McNeil to give us this information. This is not my area, this is not my lane, but one of the things that I'm running on, one of the platforms that I am running on is providing equity to marginalized communities. And the difference between equity and equality is that equity does the work. Equality just says, hey, you deserve to, have a chance or an opportunity, but equity actually gets in and does the work. And so I kind of wanted your opinion more or less about your thoughts on how this rollout of this vaccine is going, and also any final thoughts that you had about it, about just the vaccine in general that maybe we didn't cover that you would like to educate us about.
The rollout of the vaccine, I think, was it was a headache. You have to remember, in our lifetime, this is our first pandemic. This is the first time that anybody in the world has had to deal with a pandemic in our lifetime. So things are just, they're trying to do their best. I've heard people who had stories about terrible, trying to get the vaccine experience. Me, I didn't have a terrible. I walked up, got my vaccine, sat there for 15 minutes, and went on my way. But I think it just depends what community you were in. I do know in more rural communities in America that it has been very hard to get to those communities and to those people for them to get vaccinated. So it just kind of depends on where you're at. But the rollout it's been rough. I think that as time goes on, it's gotten smoother, but that beginning part was rough. Trying to get that out to as many people and, trying to get the help, the nurses, everything organized. That was a lot of work to try to do so quickly. But now I feel it's rolled out a lot more better. It's better rolled out now, that it's been some time and there's more of a process to it. They know who's had the first dose, they know who needs the second dose. And everybody who's been vaccinated, the government knows because there's a website that the government has with your information. When you were vaccinated, what vaccine you were vaccinated with, and who vaccinated you. Is there any other topics or anything you think that I didn't touch on that you wanted to talk about?
I think now that you mentioned that too, another big question that a lot of communities of color that may impact hesitancy will be, why do they need to know all my information? My name, my birthday, social security number. Why do you have to see my ID in order for me to get vaccinated? That's a serious issue for a lot of people of color, as you and I both know. Some of us don't even, are just fearful of giving away our personal information to the government. So could you speak to that and maybe why the state or the federal government would be interested in knowing your name, your social, your identification? Why is that important?
Yeah, it's honestly for tracking purposes. I mean, the government, hello, they gave you your social security number. They know who you are. They need to know who you are so that they can track it. They're just trying to track. That's how they're giving us the statistics. How do they know how many people died? Because they know their name, they know their birthday, they know their social security number. So they have to be able to track who's alive, who's not alive, who got the vaccine, who didn't get the vaccine. It's for tracking purposes. That's the only reason. They're not trying to sell it to another country or something.
Do you have any kind of thoughts that maybe you would like to educate us about that that come to your mind that may directly impact our community?
Yes. So my thoughts about our community is that we, brown and Black people, are most likely to die from COVID-19, due to comorbidities, which is the Black and brown community have very high populations of obesity, chronic kidney disease, heart disease, and those things. And people with the more comorbidities you have, the more you're likely to suffer severe consequences from COVID. How many Americans are obese? There's a lot. If you go by the BMI scale, more than, I want to say 75% of Americans are considered obese, right? According to the BMI scale. And that's one of the main factors for COVID. There are so many people that just don't take care of themselves. And we're just under, unfortunately, we're a community that has a lot of we just have a lot of comorbidities and people who have these diseases, people who don't go to the hospital or don't seek care because they don't have money. It goes into so many other issues and topics regarding the Black and brown community. A lot of times these people can't, like I said, they can't be treated. They don't have money for medicine. So they can't even keep their conditions or keep themselves healthy because they can't afford it. And unfortunately, healthcare costs a lot of money. And yes, you have a right to emergency healthcare. No one, no emergency room can turn you away in America. But when it comes to taking your medicines every day, taking your blood pressure medicine, taking your diabetes medicine, trying to eat right, those things play a factor in your overall health. And we have just been discouraged, and a lot of Black and brown Americans fall into that category, especially the elderly that are on fixed incomes. My dad, he is on a fixed income. He complains about having to get his prescriptions every month. So I understand when people, can't afford to take care of their health care, or they don't want to go to the hospital because they don't want another bill because they're on a fixed income. There's a lot that goes into that, especially in the Black and brown communities.
And I appreciate you for that very that heartfelt message. There are a couple people that joined the room. They're my family. I just wanted to say, hey, if you ladies, either one of you ladies have anything that you want to maybe, you want to be heard on, or if you feel more comfortable putting in the chat, I'm happy to read whatever you put in the chat while I'm kind of talking about what I need to talk about. So I'll give y'all a couple minutes if you want to be heard on this, to input it. I just wanted to thank you again, Keontae, for making yourself available for this important message. And as a candidate, as I mentioned before, as a candidate for Broward County Commissioner, this is my thing. This is something that I feel like we have to make more accessible to communities of color, because I believe that accessibility will increase participation in getting vaccinated. I'm gonna just drop a couple, comments in here real quickly about where we are today as far as in the community that I live and work in, and that my children are a part of right now. So in Broward County, interestingly enough, we are the second largest county here in the state of Florida. Second most populous, let me say that. And in Broward County, we have the second highest rate of infection of COVID-19 as well as deaths today, as of today's date, with Miami-Dade County being number one. And within this subsection of people in Broward County, I want my community to know that African Americans, you have the highest rate of mortality based upon COVID, right? We die for different reasons, but even though we represent a minority percentage of the population here in Broward County, our mortality rates are still number one when it comes to COVID. We're number one. More likely to die and more likely to get infected with COVID-19. And taking away race, right? Taking race out of it. I also did some research to see which gender would be most affected by COVID-19. And as it pertains to the mortality rate, men, coincidentally enough, are dying at a much higher rate than women are. I have some thoughts about that. I think I know why it might be, but I thought that was pretty interesting because in my mind, I always felt like women were more vulnerable of passing, of catching COVID and of passing away from COVID. So those were just kind of like some stark statistics that I obtained from the Florida Department of Health with regard to COVID, as well as Broward County. And this information is publicly made available here in our state. And even if you're not, within the state of Florida, you can also get this information from the CDC's Center of Disease Control's website. I think wherever you're at on the spectrum with regard to COVID, I think you deserve to know data. You deserve to know the numbers that we have, right? Because another thing that we have, Nurse Jones, is that we have people literally walking around here today, walking around in our schools, in our hallways, preparing our food when we go out to eat, that may have COVID and don't have a clue that they have COVID, and spreading it to people. And my thing is, it doesn't matter where you are at on the spectrum. I think we just all have to kind of act like that we are in a health pandemic, as my cousin said. My cousin's also a nurse who's here as well. We have to act like we are in a pandemic. So again, to piggyback off what you were saying, Nurse Jones, with regard to, can nobody make you get this vaccine, right? I'm not here to force it on you one way or the other, but I think you do have to conduct yourself as though there is a real live global health pandemic that is killing people. Go ahead.
Absolutely. I think, like you just stated, you have to conduct yourself. Yes, no one can make you get the vaccine, but for the people that are out there that just are careless, that don't want to wear masks, who don't care about other people, that's not right. You need to at least stay 6 feet away from people. Wear your mask while you're out in public. What you do in your home is your own business, but don't go out there and try to not care about other people. And I think that's one of the biggest issues, is that we don't care about other people. And you need to care about other people in your community so that the community can survive. If you don't care about people in your community, what's going to happen? how can the community survive? And I just think it's such a hot topic, and there's a lot of people that are divided on it. There's a lot of people, of course, that feel that they are being forced to take the vaccine. And it is mandated, but no one can force you to do anything. They're giving you a choice that you don't want to have to make. That's what it is. There's especially, I think I just posted either today or yesterday that all nursing home workers have to be vaccinated by a certain date. There's no ifs, ands, or buts. There's no religious exemption. They want you to be vaccinated. And I think people in the community, if you're caring for other people, especially people that are in roles as nurses, teachers, you're caring for other people. So why would you not want to protect them? If you have a caring heart and you want to be a teacher and you want to educate and you want to be a nurse and you want to care for people, I know that I've been a nurse for over 20 years. And to be a nurse is to give of yourself and to care for other people. And if you don't want to do that, then you're in the wrong field, especially as a nurse. And that's why I don't understand some of these nurses that are like, well, why are you making me do this? Hello, we had to become a nurse. You have to get vaccinated for hepatitis B. You have to have the flu vaccine. There's all these things you have to do to take care of other people. And you know that when you become a nurse. It's not just thrown at you. You're given that option. Do you want to do this? And I don't see how nurses, especially, are like, I don't want to do this, when all along we've had to give of ourselves. We've had to, most nurses that work in long-term care, you get people with MRSA and VRE. Half the time, whatever your patient has that's communicable, the nurse ends up getting a lot of the time. If it's not TB, if it's not scabies, if it's not MRSA, if it's not one of those things, we end up getting a lot of stuff that's communicable from our patients just from caring for them. It doesn't matter. But if you signed up for that, then okay. And I see the comment from
yes.
I believe you can still protect people by boosting your immunity and wearing masks. Yes, I believe that you can boost your immunity. But like I said, it comes down to prior to the pandemic, prior to this happening, how many people were healthy? How many people cared about their immune systems? How many people were taking vitamin D? Or how many people were at McDonald's in the drive-thru line? So prior to the pandemic, you have to be taking care of yourself and building on your immunity and working on yourself. And yes, that a lot of people can. I think your immunity has a lot to do with how severe, if you contract COVID, how severe you get it. Most definitely.
And I know we had addressed this beforehand, but kind of some key takeaways. The comment was posted here. I'll read the comment, and I know you restated it. We probably talked about this maybe like twice, but for the sake of conversation and just making this a neutral platform to where all people can feel heard in a safe space, let's go ahead and address this one for the record. So I won't mention her name, but we have a comment here that states that the time is different because the vaccine has not been studied long-term, and I'm concerned that the vaccine reactions are not being reported. What do you say to that?
So what I say to that is you're correct. The long-term effects, we do not know because we're not there yet. We cannot predict something that we're not there yet. And like I said before, you have to decide as an individual person, do the benefits outweigh the risk? Do the benefits of taking the vaccine outweigh the risk of dying of COVID-19? That's a personal decision. And that's a decision that everyone has a right to make. So if you feel that you want to not take the vaccine and do other things, then that's your right. That's most definitely your right to do that. And regarding the vaccine reporting, I had pulled up the VAERS uh, report for 2021. And like I said before.
Did you say the VAERS report? Could you explain what that is?
Yeah. So yes, the VAERS report is the Vaccine Adverse Events Reporting System. So that's been in the make for years. Like any vaccine can be reported to VAERS. But since the pandemic, there's been all these reports of adverse reactions from the COVID-19 vaccines. So there's thousands, like literally thousands of reports. But if you go to the VAERS system, it'll tell you anybody can report on there, and they don't confirm everything that's reported. They do investigate deaths, but there's reports on there from people having redness at the site all the way to deaths. There's people that, I mean, the report is thousands of pages. And there's people on there who just had comorbidities. Some did, like everybody's different. Everybody's an individual. Some people had comorbidities and were fine. Some people had comorbidities and weren't fine. Some people went into anaphylactic shock. Just like I said, when your body has an adverse reaction to something, it does not take 2 weeks. It's going to happen within minutes. Every nurse knows that. Anytime there's an anaphylactic reaction, it's going to happen within minutes. It's not going to happen weeks later or 5 days later. It's going to happen right then and there. Did you not know about the VAERS system, Dameka?
Honestly, sister, that was my first. I had never heard that. But like I said, the sad part about, what we do is that we, as attorneys, we get sad, and I could probably say this is probably the same for everybody in any, whatever lane or profession that you may be in. It's like the sad part is you fail to educate yourself about other things, right? And that's why the main reason why I wanted to do this, because I felt like there's been a lot of conspiracy theories on both sides. Listen, on both sides. I'm not here to make this, like you indicated before, we're not here to make decisions for you. We just want you to know and have the information so that you can make an educated decision with regard to what you want to do. Me personally, I've gotten vaccinated. I believe in getting vaccinated. I'm going to have my children get vaccinated because I feel like, again, what you were saying, Nurse Jones, that when we do our part, we protect those that are not able to do it, and so I'm willing to take that risk. To me, in my opinion, I don't see it as taking a risk for me and my children. I see it as being nothing but a benefit. I do understand that there's been, people who've had the vaccine and have gotten it and died. But for me, I feel like the benefits of being vaccinated outweigh the risks of getting it and being hospitalized and potentially dying from it, especially when it's available to me and I have the means to get vaccinated. So I wanted to say that, but we are by no means, and I don't think Nurse Jones is either, we're not telling you this is what you better do or whatever. That's not what we're saying. We just are here to educate you about some of the benefits of the vaccination and what you choose to do with that, you choose to do with it. Right. But I felt like it was important that we collected ourselves as people and members of our community to educate those, right? To educate us.
Yeah.
That's it. We have another comment that says, I believe it would be a choice. I vehemently disagree with the mandates. We should have the right to choose. What do you think about that, Nurse Jones? I agree. I think we should absolutely I don't want nobody making the decision for me, but my decision is I'm gonna go get vaccinated, and I don't care until listen. Anytime they make it available for me, that's exactly what I'm going to do. So, are you pro-choice, or do you believe that there should be mandates? Again, your opinion. I recognize you're not a lawyer, but just your opinion.
Just my opinion is that anybody should have a choice of what they put in their body. You should have a choice. Now, is the government making that choice difficult for some people? Yeah, they are. They're literally making it where you almost can't survive if you don't, especially in the healthcare field. I've seen nurses walking out, being escorted out or walking out because they refuse to be vaccinated, and that's their choice. It's your choice. They're asking you to make a choice you don't want to make. All these companies that are mandating their employees to get vaccinated get some type of aid from the federal government. When the federal government mandates.
Wait a minute. What? I've never heard. Okay, can you restate that?
Okay, so so nursing homes, right? They get paid by the government. They get paid by the Centers of Medicare and Medicaid. That's who pays them. So if they don't follow the federal rules of mandate, they don't get paid. So guess what? They're either going to mandate you to get the vaccine, or they're not going to get paid. And you think these people are going to close down their business because you don't want to get vaccinated? No, they're going to let you go, and they're going to continue. It literally comes down to money. Literally.
I want you to stay on that thought, but for those, can you stay on that thought real quick? I just wanted to say something real quick, because I feel like once someone watches this replay or whatever, they're going to come up with another spin-off conspiracy theory, right? And so what I want to do is the resident lawyer in the room, I just want to clarify something real quick. What Nurse Jones is saying is this. There are some businesses, organizations, hospitals, whatever, that receive money from the federal government. It doesn't matter if it's about a COVID vaccine. It doesn't matter if it's whatever, they are getting paid by the federal government to run their business, number one. Number two, what she is also saying is this: if they want to continue to receive federal funding, they have to abide by the rules that the federal government puts into place. One of those rules is, for example, would be a healthcare mandate, mandating its employees or whatever to get vaccinated in order to receive or to follow the rules of their guidelines in order to get vaccinated. So what I don't want is people to watch this replay and try to spin what you're saying and make it seem like, oh, they're giving away money to get vaccinated. That's not what she's saying. What she's saying is that the federal government has put rules into play, and in order to receive those funds, you have to abide by their rules and their regulations. True enough, one of the regulations may be a federal vaccination mandate. So it would be something akin to getting PPP. Everybody get PPP, SBA funds. You're doing everything you have to do there, right? Oh, no. But when it comes time to getting this money, everybody tries to spin it off. So I just wanted to make that clear. And again, playing devil's advocate, but I just wanted to protect us all here, no matter which side of the spectrum you're on. I just wanted to protect everyone here against the spread of misinformation. So sorry to go off on a tangent, but yes.
No, thank you for clarifying that. You said it perfectly. Yes, these companies get funding from the federal government, and there are a lot more companies than we know get funding from the federal government, and they're going to continue to get funding from the federal government. So they're, like you said, they're going to have to follow the mandate, the vaccine mandate, and that unfortunately puts their employees in a position where they have to choose to either work for that company or not work for that company by not, if they don't get vaccinated, they don't work for that company. And, that's a decision that a lot of people don't want to have to make. And I get it. I don't think it's fair, but it's a choice. It's just not a choice we want to make. It's not a choice people want to make.
Okay, so we got another message coming through the chat that said, I am acting as an advocate for the non-vaccinated. They indeed have paid businesses, influencers that are not funded by the government to push vaccine compliance. I'm just going to reread that. I'm not trying to be difficult. I'm just trying to make sure my understanding is correct. Or whoever put that in there, maybe could you follow up with a comment? Because I guess where I'm getting confused at, I think I know what you're saying, but just put something in the comment section if I'm misstating what you're saying, because I don't want to misstate it, or kindly unmute yourself. But I think what you're trying to say is that the government is paying like rappers or entertainers to come up with commercials in order to encourage vaccines. Is that what you're saying? Okay, perfect. All right. So I agree with you. Okay, I'm me, I'm a straight shooter. And listen, even though I'm a candidate for public office, I speak truth to power. Because I believe that if we approach with truth and authenticity, you either, again, you have to make a decision for what's for you. Now, my opinion is that I feel like our federal government is paying these people or seeking for them to endorse it so that certain communities will feel comfortable with getting vaccinated. Again, I'm a vaccinated person, but I'm also pro-choice. Okay, I can't stand for women to have be pro-choice about their bodies or whatever, and then try to say, oh no, you can be pro-choice about women, but you can't be pro-choice about this vaccine. That's not what I'm saying. What I'm saying is that my opinion is I feel like the reason why the federal government is seeking endorsements from celebrities, from influencers in our community, is to get our community to feel comfortable with taking the vaccine and to decrease vaccine hesitancy within the communities of color. That's my opinion. I would like to know the opinion of a non-vaccinated person who chooses to be non-vaccinated, not because of accessibility, but purely you know there's a vaccine, you have access to it, and you just stand firm on it. That's my opinion, but I would like to, Nurse Jones, go ahead, you can jump in. And if someone that's a non-vaxxer is present, type it in there. I'd like to know your opinion. That's what we're here for.
I was just going to say, Dameka, that there are also influencers that are saying they're not getting the vaccine, there are reasons why. So there's also those influencers out there influencing their people not to get it. So it's not one-sided. It's not one-sided at all.
Oh, I was just like shaking my head up and down because I'm like, yeah, you know what I mean? But the thing that we have as Americans is that we choose to, what we agree with, what we believe in is what we believe in. And we tend to, a lot of people cannot be neutral or able to see the other side. But I agree with you 1,000%, 1,000%. Not sure if someone else had any input on that particular issue, but I do agree with you. Some of the commercials are very much pandering to me. Very much pandering. And I also have another conversation that I have with some of my clients too. People, I hate to stay on this stump, because I'm really trying to guard, Nurse Jones, guard myself against seeming one-sided. So check me if I'm not.
Okay.
But a main issue that I have with my community, leave it at that, is that we do all this other stuff to ourselves that are not healthy at all. I'll try to be neutral, having poor diet. neglecting mental illness, neglecting the fact that you may have a substance abuse issue. But when it comes to the vaccine, there's an issue. There is an issue. I just have serious problems with that. But again, being neutral, right? I'm trying to be neutral because, again, I understand the hesitancy issue. I do. But for me and mine, I just don't feel like the risks outweigh the benefits for me. I don't know if you have any particular thoughts about what I just said, but I'll pause and I'll allow you to respond.
No, I agree with you. I I agree. Like I said before, I think it comes down to choice. I'll speak from my perspective. I have a friend, a guy friend, and we go back and forth about this COVID thing, the vaccine. And I said, just tell me, just tell me the truth. Why don't you want to take the vaccine? I said, do you feel it's going to harm you? You know, what is your sincere concern? And his answer was, I don't want no one telling me what to do. Literally, I don't want anybody making me do something. So I asked him, I said, well, if it comes down to your livelihood with your job and being able to feed your kids, are you going to take the vaccine or are you going to stand firm? He goes, oh no, then I'm going to take it. And that's a lot of people's stance. I'm not going to take it until I have to take it. And I'm like, that makes no sense to me. That makes no sense when, like you said, we're out here. Other people in the community, they're out there doing other very, very harmful things to themselves. But you won't take a vaccine that would possibly stop you from dying. Like I don't understand the logic in that, personally. But like I said, everyone has a choice. Everybody can make that choice. I know for me, it just hits home a lot more because I'm a nurse and I see, I have a very good friend of mine who is a mortician. And I know that people thought that when the media was showing people being placed in trucks, cooling trucks and stuff, that was not real, but that was real. These funeral homes are saturated. They are, I have people who lost loved ones. I have a friend who lost her daughter, not due to COVID, but she lost her daughter. And they told her, ma'am, we're going to have to wait 90 days to bury your daughter. That's ridiculous. That's ridiculous. That's how many people are dying. That's how saturated these mortuaries are. I see people, I see what the average person doesn't see because I'm a nurse. I see people on ventilators. I had a friend, his brother's wife, unfortunately came down with COVID. She was in the ICU. The doctors came to him and said, I need you to make a decision. It's either we save your wife or we save your baby. We need you to make a decision now. That's a terrible position to be in if you don't have to be. I have friends who are nurses and they're, letting them use their iPhone to say goodbye to their family members because they're about to die. So my heart breaks when someone dies when they didn't have to. They didn't have to. And they're sorry that they made the decision that they made, but now it's too late. And that doesn't only go for the vaccine, that goes for, I see that all across the board in nursing. That goes for many conditions. You make a decision, and then once you get a consequence from that decision, you're sorry, but it's too late. And then I'm the nurse that has to hold your hand as you transition. That's a very hard thing to do. Very, very hard. And I feel like if people saw more of what really happened to these people, they would reconsider just for themselves. Like I'm so passionate about people not dying if they don't have to. We only have one life, one. We get one shot at this. And for people to not, just, people get to make choices every day. And unfortunately, we have to live with our choices, but it's really hard as a nurse to watch people pass away and stuff when it didn't have to happen. Family members, there was, in my community recently, about a month ago, there were two nurses, worked at a hospital. They both came down with COVID, left 5 children. That was heartbreaking. That was like right here in my community. It was heartbreaking. They had 5 kids. Both parents died of COVID because they were nurses helping other people. So it's that kind of stuff that gets to me. It's the whole cycle, and it's just sad. And everybody gets to make their choice.
No, I just, I appreciate you so much for sharing that. I just couldn't think of more of a better illustration, about, again, being educated about the vaccine. We got another comment, so I want to read it. Tuskegee experiment was done less than 50 years ago. The government admitted they gave vaccines and lied about what was actually being done. The NIH and WHO were involved. That causes grave distrust in the system for me. Very concerning. We addressed this. Do you mind quickly answering it real quickly?
No problem. Yeah, we did address this a little while ago. And yes, the Tuskegee experiment did target, Black men. And yes, the NIH was involved and the World Health Organization were involved. But like I said before, this vaccine is not just being rolled out to African Americans. This is a worldwide pandemic. This is not isolated to one social group, one ethnic group at all. This is worldwide. So I feel myself personally that this is very different from the Tuskegee experiment.
Do you mind? I think I don't remember whether or not you addressed this, but could you explain? Do you know which vaccinations were given, or perhaps the commenter could answer that question? What vaccines were given in the Tuskegee experiment? Okay, syphilis. So I knew it was an STD. I just couldn't think which one it was. So for those that maybe tune in late or don't know anything about what the comment is referring to, so what this person is indicating is that there was a Tuskegee experiment that was, I'm assuming they said it was a vaccine, but what was really inside of the vaccine was syphilis. And it was being administered to, was it just being administered to African American people, or was it like people of color? Like that part I don't understand. Oh, a placebo. Okay, go ahead, Nurse Jones.
It was African American Negro males.
And then they stated that the government admitted, I guess, after the fact, that they lied about those vaccines being done. And I think you mentioned before that you find that again, we're not endorsing one way or the other, but your personal opinion, you've happen to personally feel like the Tuskegee experiment is different from this COVID vaccine rollout, is totally different. But I guess the layperson would want to know why. Why is this different?
Well, because in the Tuskegee experiment, it was targeted. They were going after African American men. This was a targeted group they were going after. And this goes into many other topics, but this was a targeted group. This vaccine, the COVID-19 vaccine, is not targeted. This is not targeted at anyone. This is, like I said, this is worldwide. This is not just one group at all, if that makes sense.
No, that makes perfect sense. And I want to ask a question to the person that posted that comment. What do you feel like are some of the similarities? Or do you find that the only similarity is that it was a vaccine rollout type of thing? Do you have anything else just to provide balance, right? Do you have anything else that you find that happened in the Tuskegee experiment that gives you hesitancy about taking the vaccine right now? It's the fact that a complete lie was told in regards to the treatment option. Are you talking about a complete lie was told? Is that the similarity that you're talking about? Because, and I don't know, Ms. Jones, if you want to help me provide balance to the room, that's a real concern within our community. And I can just provide my little 2 cents on it, and I'll let Ms. Jones piggyback if she has anything to say, not obligating you to comment on it at all or whatever. But I find that I completely acknowledge everything that you're saying. Not only do I acknowledge it, I want to make it clear that I am a staunch advocate for marginalized communities, period. My second point to that is, in my personal opinion, I feel like the government is not saying that vaccinations are the only treatment option in my eyes, right? I think that they're saying it is the best treatment option. And if you don't want that, socially distance, wash your hands and wear a mask. That's how I see it. But I don't know if you want to provide balance in the room. Ms. Jones, if you have a different opinion or if you have a similar opinion, let me know what you think.
Yeah, I don't feel like they're saying vaccines are the end all be all. There are people who, like discussed earlier, that try to build their immunity and do other things, hand washing, wearing masks, just doing the basics regarding COVID. That's how.
Okay, and then the commenter also stated that the similarity is that they are not always honest about their motives. I completely agree with you with regard to the Tuskegee experiment, to the person that commented that what that was disgusting and completely disparaging to the medical community. What happened to the people that were participants in that experiment, it's disgusting. I, again, as being a vaccinated person, and again, just trying to provide balance to the room, and you feel free to fire off if you have to. I don't know what the motivation would be as a vaccinated person, other than to get as many people vaccinated as possible to protect those that cannot be vaccinated. That's how I see it. I don't see it as and trust me, listen, I know that my people have been victims within the medical community. Again, I'm running on a platform for marginalized communities. So I don't want that, I don't want someone to chop and pick and choose my words and take them out of context. I am an African-American woman. And in terms of the social hierarchy, I consider, not I, but I view the world's view in the social hierarchy is that Black women are at the bottom. And that white men, are at the top. So I'm very aware of where my people, specifically Black women, are in terms of social hierarchy. And I understand and I acknowledge the fact that Black people in general, Black, brown, and indigenous people have been the subject to some of the worst atrocities that completely are rooted in racism and motivated by racism. As a vaccinated person of color, I don't feel like the government's motive is to kill me by getting me vaccinated. That's my personal opinion, just mine. I don't know, Ms. Jones, if you feel like there's a motive.
Oh,
that you want to speak to?
I honestly don't see a motive, but I do understand. Just like the last comment that was posted, I totally agree. African Americans have been used as lab rats a lot. I agree with you when you say Black women are at the bottom. Yes, they are. Most definitely. Still to today, um, Black women, especially during, especially childbirth, even in the medical field, Black women aren't heard. We're not heard. And unfortunately, in the medical field, when you're not heard and no one's listening to you, um, unforeseen circumstances do happen. And it happens to a lot of Black women. It really does. And even Black men. Black men, for some reason, are just um, construed as strong. They have this persona of being, strong and threatening and unbeatable. And so they're not believed a lot either when they come into hospitals. But Black women have it the worst, I would say, when it comes to the medical field.
I couldn't agree with you more. I just couldn't. We got another comment that I strongly agree with as well. And it's not just the Tuskegee experiment. The reason why a lot of Black people are hesitant to get the vaccine is because Black people have been used as lab rats for centuries, which I think, to your point, is what you mentioned when it comes to the medical field. So now when they get this vaccine, a lot of us are hesitant and want more information. And I don't agree. I don't disagree with you at all. I say get your information, make a decision for you that, and in consultation with your primary care physician. Again, I'm not a medical professional. I'm not sure, Nurse Jones, if you have something that you want to supplement, considering the fact that I'm not a medical professional.
No, like I said, they should contact their primary care provider and discuss it with them and make a decision because everybody is individual. Everybody has individual things going on with themselves, and you just make the best decision for you. You and your family, or you and your children, whoever, you make the best decision that you feel, and I think that's what we can all do in any given circumstance. We make the best decision off the information that we have at that time. And that can go across the board for many decisions that we have to make on a day-to-day basis. We make the best decisions off the information we have at that time.
We have another nurse in the room. I'm not sure if she agrees with that. Maybe you can type it. Oh, she did. She said, I think we all agree on that. I completely agree. As a legal professional, I'd be remiss if I had told my clients, oh, just sign this paper. Here you go. Don't worry about what it says. Don't ask me no questions. Don't question me. Don't question the system. I felt like it would be extremely hypocritical of me as a public servant and as a person that's taken an oath, not to a client, but I took an oath to the state. And I also took an oath and swore by the Constitution to protect it. And one of the protections of our Constitution is that you have a right to know what is going on, period. And you have a right, not only a right to know what's going on, but to make a decision intelligently and voluntarily. So I just think I could never, and that's why I felt like it was so important to do this conversation, because I could never come before you as a candidate for office and tell you to not make an informed decision, but to be informed, right? Not be informed by conspiracy theories and things that are not backed by anything other than what, I'm going to take it when I'm absolutely forced to take it. You don't even have a real reason why you don't want to take it. You know what I mean? So for me as a candidate and a person in a leadership role, whether it be if I ever get elected, win, lose, or draw, or whether I'm a leader in my home, a leader in my business, someone that people look to for guidance, be informed. Make your decision, again, in consultation with your physician and with your family. Those are going to be the people that are affected. Like Nurse Jones was saying, you mess around and catch COVID, you bring it home to your kids and they're affected. You know what I mean? So I just feel like that's a huge responsibility, and I'm not here to make it for you, but I feel like if you are going to get information from anywhere, then you need to get it from, again, a trusted source and an ally of yours. Because as Miss Jones and myself was both saying, we are Black women, and in terms of the social hierarchy, we are viewed at the bottom of the totem pole. Like, I don't agree with that, but that I can't also live in a world where I feel like I'm on the same playing field as a white man. So I guess that's what I mean. That was the whole purpose and motivation behind doing this, is, again, not to make a decision for you, but to let you hear from people that share your struggle and that are okay with being objective, but are also going to hold you accountable if you are not informed. Hope I'm saying that right. Okay. And then we have do you agree with me or have anything that you want to add? And another nurse here in the room also agrees as well. She says that she's been an RN for 11 years and she's seen a lot, in bold words, lot. And I believe in doing no harm as a medical professional. I believe you really shouldn't be a medical professional if you are doing harm. But she's saying that she believes in informed consent and that we all agree on that. And I could not back you up anymore.
Right. That is the oath that we do take as nurses, is to do no harm. Do no harm. And that's very true. And informed consent, yes, is number one. You should be informed regarding any decision that you have to make.
I also got a text message of a person that's watching. And again, this is something that we've already addressed before, but maybe if you could just quickly address it. I got a text message from someone that is a breast cancer survivor, and that, we have people with varying disabilities, but this person in particular is a breast cancer survivor. And she stated that is the reason why she's not getting vaccinated. Do you know what research, if any, or I don't know, like, is that a subsection of people that you would consider to be immune compromised? I think the word you used was something along the lines of like immune compromised, but I don't know if I'm using the right word.
So like I said, they would have to, she would need to see her oncologist, because there's various stages in cancer. If, they could be 5 years out, they could be 10 years out, they could, it just depends. It would depend on certain circumstances. And that's when you would need to consult your doctor and say, well, is this a good thing for me, or should I opt out of this? That's something that you have to discuss with your doctor. And it's honestly on an individual basis, because, like I said, people are different.
So again, going back to your original point, the key takeaway is that, again, and Ms. Jones, cut me off if I'm speaking or misspeaking or overstating anything. But again, I think what I'm able to take away from that is that you should be making a decision about vaccination in consultation with your physician, with your physician.
Yes, yes, and yes. Yes.
Okay. I hope I wasn't overstating anything, because again, this is not my lane, and I'm not trying to present myself as though I am a medical professional. I tip my hats off to those that are here that continuously have been on the front lines battling this and other stuff going on. Someone else is joining, so I'll give them a couple minutes. They may have some questions, but I kind of want to go over what we've talked about today. For those that are just joining. So, and then cut me off, Nurse Jones, if I'm wrong. Okay. So what we talked about today was really, really super fascinating. And I'm just so grateful for your service and helping me put this together in such a short amount of time. So if you have any questions, now's the time to ask it, because we'll be ending soon. but this is what I got from it. And then just kind of, I guess, back me up if I'm overstating something or not stating it correctly or whatever the case may be. First thing that we talked about, or that you presented to us, is that first, most importantly, we should be making a decision about the vaccine in consultation with our physician. That's number one. And that, there may be some side effects associated with the vaccine, any vaccine that you choose to take, whether that be Pfizer, whether it be Moderna, or whether it be Johnson and Johnson. There may be some side effects to it. And that, in your opinion, if I'm stating this correctly, but in your opinion, it doesn't matter which vaccine you take, that they all pretty much kind of have just about the same efficacy rate. And I didn't catch what efficacy was for folks that just don't know.
So efficacy is the effectiveness. That's what efficacy is. So, and they all do have about the same efficacy rate. So yeah, the same effectiveness for each of the vaccines.
Perfect. And that if we, in the instance, I think I was acting like one of my clients. I was running a hypothetical on you because I knew someone that this happened to. They got the vaccine, messed around and got COVID. And then they were like, oh my God, I need to get another vaccine. That based upon the opinion of the medical community, you should wait at least, I think you said 6 or 7 months before you get another vaccine, correct?
For the 6 or 7 months, I stated that is when you're eligible for the booster.
Oh, okay.
That's when you're eligible to get a booster. It's 6 or 7 months. That's what the CDC has put out for the booster shots that are now available.
And do you mind restating your position one more time for that hypothetical? Because maybe I misunderstood you, but I don't want to participate in spreading misinformation.
In my opinion, that you shouldn't run out and get the vaccine when your body is still recovering from COVID. And that, one, you need to test negative, because I said that there's other people, they think that they got COVID, they have symptoms, and now they don't have COVID anymore. But I've known people who tested positive for COVID for months, even though their symptoms are gone, they tested positive still. And then I think after you test negative for a few weeks, then you can go get vaccinated. But I don't think you should do it right away. No, I had an uncle that did that. He got very sick. And he, like you said, like in your hypothetical, he was scared. He got COVID. Oh, I'm not being vaccinated because they don't kill me. So, and then he got vaccinated and it almost killed him again. So I think you should wait a little bit.
Perfect. And you also debunked a myth that's spreading around in our community with regard to doctors or hospital, we'll say medical staff, being paid in exchange for diagnosing people with COVID. You indicated that your colleagues are overwhelmed with COVID patients, with treating them, and that your opinion is, that the people being paid to diagnose people with COVID is false. Did I state that correct?
Correct. And as a nurse myself, you couldn't pay me to work at a hospital that was just saying, oh, people had COVID. Like you couldn't pay me to do that at all.
And I also wanted to kind of recap your position with regard to, people still dying with COVID. We used the example earlier of Colin Powell, who did get the vaccine, but ultimately died from COVID. Your position was, we don't know all the facts to make that type of connection. Is that correct?
Correct. Like I stated before, we don't know Colin Powell's comorbidities. We don't know what he was taking. We don't know what actually happened. The only people that know that are the medical team that treated. So we can't say, oh, he got, we can't speculate on that because we weren't involved in his care.
And another thing that we kind of all came to an agreement as people of color was that we completely acknowledge the fact that there are disparities within the medical community with regard to how people of color are treated. Hope I'm not stepping on your toes with that. Would you share that opinion? We acknowledge that, there are disparities within. Okay. And I think the example that you used is that, a Black man could come into the hospital and complain of pain, and, he could be like, oh, I'm in pain. And people just not take his pain as serious as they would as a non-person of color. And I think you also indicated the mortality rate of African-American women that are giving birth is the highest. Yeah. Or I don't know if you went that far. Did I step on you?
It's high. It's high with African-American. But yes, your statement is correct.
Okay. Some comments also came out about the Tuskegee experiment, to which you and I both agree is a fact. It's terrible. We don't agree with what was done to men that were, I think it was just men, or I'll use a blanket statement. We do not agree with what was done to the African-American people in the Tuskegee experiment. We don't agree with that at all. And we acknowledge that that happened. But I think to your point, you stated that there are stark differences between what happened with the Tuskegee experiment and what is happening now with the vaccine rollout, namely because it's not targeting a specific group of people. Did I?
Correct. That's exactly what I said.
Okay. So far, so good. And then we also discussed that I think we all kind of got on board at the end, which is beautiful, which is what I do with my juries when I'm in court for trial, is that we all kind of come together and say, you know what, you have an opinion that you don't want to get vaccinated, and that's your absolute right. But we all agree, we all came to the table about being informed. Did I get that right?
Yes.
Awesome.
Yes. Informed, making informed decisions. Yes.
Okay. And I think that's a great place for me to end. I don't know if you want to say any closing thoughts or anything that you'd like to add, or if anyone else here would like to add something.
No, I think that's what what you put this together for, is that so people could have information and be informed about the decision to take the vaccine or not take the vaccine. I think that we've done that.
Well, once again, I just cannot thank you enough. I'm so pleased with the goal, because I feel like we hit our goal. I don't know. Am my people in the audience, did we hit our goal? Did we kind of come together? Because that's what I kind of like to do in the courtroom. So and what I'm hoping that I'll be able to do as the as the Broward County Commissioner, if I'm elected, I love having conversations that are real and that are heartfelt, where everybody feels heard, and hopefully working towards one goal. I think that's the most important job that I have as an attorney, and most importantly, the most important job that I would have if I were to be elected to be your next Broward County Commissioner. Hey, listen, I am on the campaign trail now, okay? And my biggest ask for you, aside from taking this information and sharing it, engaging this content, and informing yourself of what you want to do, my biggest ask, would be that you donate and you support the campaign at www.davisforbroward.com. Thank you so much to you and to the nurses and the medical professionals that are here in this room and that are watching this or may catch this on replay. We cannot thank you enough for your service, for your incredible courage and bravery that you've had during this difficult time. As Nurse Jones has said, we have never had a time like this, ever. And so all of us are trying to grapple with, do I send my kid to school? Do I vaccinate my child? Can I go to the grocery store? All of us are kind of tackling this, but I urge you, I implore you, the same way that we were all able to kind of come together at the end, I pray that you're able to come together in the end of the day with regard to what you want to do for you and your family and ultimately your community and the people that you come into contact with every day. Thank you so much, Nurse Jones. Again, I cannot thank you enough. I appreciate you. And someone saying the information about vaccinations is definitely appreciated. Thank you so much for everybody tuning in, whether it's live or whether it's via replay. I thought we made some really good ground. Nurse Jones is a legal nurse, and I would like for you to plug your business if you have a couple minutes, and I'm happy to put it in the chat for you as well while you're talking.
Sure. So my name is Keontae, and I am a legal nurse consultant. I consult on medical related cases for attorneys, anything medical malpractice, personal injury, toxic tort. I also attend defense medical exams for attorneys with clients who have been in car accidents, have had issues with other cases. I don't know if you guys seen recently, I posted it on my story, that Vanessa Bryant, Kobe Bryant's wife, was asked to do a defense medical exam, and a psych one, due to his accident and the lawsuit and her and the other family members have against LA. The airline, sorry. So yeah, I attend those, which are very interesting. But yeah, I consult on many different types of cases, from children to adults to stuff that you've never even heard of. It all comes my way. I've always wanted to be a nurse, and I used to think that I wanted to be a lawyer, and I never knew how they were going to meet up, but they did. So being a legal nurse consultant is what I do. It's what I love. And it's still a way of helping people. And I love to help people. That's where my heart is to help people. Thank you, Dameka.
No problem. And I just wanted to make sure that I told you guys that, I always, I think one of the biggest responsibilities that we have as professionals in general in our community is to reach back and pull people up with us. People that have a healthy distrust for the government. I say healthy because, people of color have every right to feel like they can't trust the government. I don't shy away from making that opinion heard. But I think one of the biggest responsibilities as a professional in general is to pull our people up with us, whether that's Black, whether that's brown, whether that's LGBTQ, whatever it is. When I say our people, I mean marginalized communities. And for us, that it's biblical, but I feel like it's also just everyday things too. To whom much is given, much required. And so I hope that we've given you something here to walk away with. And I want to wish everyone a good night. Good night from the East Coast and from the West Coast. Thank you so much. And I hope that you make it through this difficult time. We really sincerely do. So thank you, everybody. Bye. Oh, can everybody quickly come off video? I can take a picture. I'm going to stop the recording.
Oops. Where's my little...